Hi everyone, this is Dr. Elsa Sanatobi Devi, the director of Manipal International Institute, and you're watching my YouTube channel. Today we have a very special workshop on first responders, mastering multiple trauma management, which is of prime importance today, looking at the multiple traumas on road. So we're involving the police department, we're involving the lay people and the healthcare professionals from all aspects of care. And we have this very special workshop, and I'll take you through. Come with me. Yes, why first responders? First responders are very important for us in terms of multiple trauma. Reason is accident doesn't always happen in the hospital. It always happens anywhere, everywhere. And therefore, we need to build capacity for the first responders. Today we have with us the entire Department of Police. We also have the traffic police. We have the entire healthcare professional from different disciplines. Because when we say first responders workshop, it is multiple professions coming together to equip or build capacity of the first responders. Hence, we have experts like Dr. Vimal Krishnan from the emergency department, Dr. Vinod Nayak will be speaking on the legal liabilities in emergencies, and also Dr. Tanvi and Dr. Joseph Thomas from the Department of Plastic Surgery, and we have Prasanna Kumara, one of the experts, nurse practitioner who is dealing with the emergencies and the critical care. We also have researchers in this area because everything boils down to statistics and the number. Hence, some of the deadly tragedies happen because of the accidents. Anytime, any place, we should be able to manage and bring to the best of our abilities to reach the hospital. Therefore, bringing the victim to the hospital is important. Understanding the legal liabilities of bringing a victim and how to handle that victim is also important. Therefore, public and the healthcare professionals' views on having capacity building workshops are prime importance today. So in this area, I have few of my students who will be working on the various researches across the tertiary care hospitals so that we bring in statistics, we bring in evidences so that we are able to prove to the public that this is important. Wound management is important, wounds of all kinds. Therefore, we have specialized wound care workshops held for interprofessional students so that we learn together. When we work together only, then we can achieve what milestone we're looking for ahead. Thank you. I'll introduce to a few of my students who are working on various areas of wound. Srinidhi, could you introduce yourself?
Yeah. Hello, I'm Srinidhi. I'm a PhD scholar in MCon Manipal, and my area of PhD work is in developing a mobile-based AI application that would help to detect the staging of ulcers, as well as it would give the vast information about management of pressure ulcers for the caregivers who are taking care of patients with pressure ulcers at their houses.
Hello, my name is Afinia and I'm a PhD scholar from Manipal, and currently I'm doing a project on interprofessional advanced wound management among the nursing as well as the medical interns. And in my project, we're planning and designing and also developing a course on interprofessional advanced wound management, where we take the students and we help them to learn together so that they can work together along in the hospital. So we're actually designing a course which will fit into their curriculum and also checking its effectiveness.
The entire day we will be having a lot of simulation which is case-based. Why learn on simulation? Because we need to see real-life learning. So when the entire team comes in, we need to know how to act, what are roles and responsibilities, what each one of us need to do in an emergency when accident happens. So when accident happens, obviously things are not going to be at our hand, but how do we mobilize and innovate and then bring safely the patient? So throughout the day, we're going to have a lot of simulated situations where the team members will come in together and see how best you can act in that particular situation. So we need the first responders to learn how to coordinate and work. So we have different roles and responsibilities, each member. Team lead is important here, and then how do we bring safety? So throughout the day, let's see how we really enjoy the real life learning situations where we will be taking through from the classroom to the emergency, where the first responders will coordinate and carry out the activities while trying to save a victim in times of accidents or any of the unwanted incidents that happens right in front of you, anywhere it could be. So I think this sort of trainings are important to equip the interprofessional team members as well as the public. That is why today we have with us lay people or the bystanders, bypassers who are on the road, who actually witness most of the victims on the site. So I think we need to know how to handle an emergency. At times I see with my own eyes, when an accident happens, in the car is being crushed, the man's face is totally crushed, and sometimes they are just lying flat on the ground, and then they take them by an auto, wherein we need to have a specialized way to bring the patients safely to the hospital, keeping in mind spinal injuries, keeping in mind the multiple injuries. Henceforth, I think working interprofessional is utmost important at this point of time, so that we can reduce mortality and morbidity, at least in the areas that we are concerned about.
We'll move away from this room. We'll go see some skills. We'll go downstairs to the place where we took photograph in the morning, and we'll demonstrate 5 skills you need to do outside the hospital, in the field. It could be anyone in this room who is exposed to a scenario where you need to exhibit those skills. Those 5 skills we'll learn. And then we'll come back and discuss those skills, and then you will see what is happening in the hospital. Shall we do that? Yes. Yeah. Collapse on the road, what do you do first? Scene safety. So scene is safe. We are all safe here. We are not in the middle of the road. We are on the side. Okay? Step 1. Step 2. Check whether he is talking. Sir, are you okay? He is only moaning. What do you do then? Check for pulse. Checking for pulse. Pulse present. What do you do then? But he's not talking well. Airway. Very good. So airway. If there is no blood, or if you do not have any suction device, you can't do anything except opening the airway. How do you open the airway? People on this edge, can you guys see? Jaw thrust. So your fingers here. Let's say I'm gloved. I have gloves. Fingers here, and then you're pushing the jaw upwards. Jaw thrust. Here. This part. Pushing upwards. Jaw thrust. Okay. Then what do you do? Collar. How do you apply the collar? Carolyn. So Carolyn, these guys are here with us. They are MSc in EMT. They've been doing a lot of work in the hospital also. They'll help us. So let's presume that they are having a glove. Okay. Step 2. She's rolling the collar. And then I come back, I hold the head. Okay. So collar is done. What do I do? I held the neck. She slid the collar. This area will come to the So the fold body, she has slit the collar. She has slit the collar.
ಹಾಕುವಾಗ ಕುತ್ತಿಗೆ ಮೇಲೆ ಎತ್ತಬಾರದು ಆಯ್ತಾ ಕೆಲವರೆಲ್ಲ ಏನು ಮಾಡ್ತಾರೆ ಹಾಕುವಾಗ ಕುತ್ತಿಗೆ ಮೇಲೆ
This is called a spine bone. Okay.
ಇವರನ್ನು ಹೇಗೆ ಹಾಕ್ಬೇಕಂತ ಹೇಳಿ ಇವಾಗ ನಾವು ಯೂಶಲಿ ಏನು ಮಾಡ್ತೀವಿ ಕುತ್ತಿಗೆ ಸ್ಟೆಬಿಲೈಸ್ ಮಾಡೋದಿಲ್ಲ ಎಲ್ಲ ಒಂದು ಬಿಟ್ಕೊಂಡಿರ್ತಾರೆ ಅವರನ್ನು ಏನು ಮಾಡ್ತೀವಿ ಮಗು ಥರ ಎತ್ಕೊಂಡು ಬಂದು ಹಾಕ್ತೀವಲ್ಲ ಸೊ ಅದು ಮಾಡಿದರೆ ಏನೆಲ್ಲ ಇಂಜುರಿ ಅಂತ ಸರ್ ಹೇಳಿದ್ರು ಇವಾಗ ಇಲ್ಲಿ ನಾವು ಹೇಗೆ ಮಾಡಬೇಕಂತ ಹೇಳ್ತಿದ್ದೇವೆ ಕುತ್ತಿಗೆ ಸ್ಟೆಬಿಲೈಸ್ ಮಾಡಿದ್ದೀವಿ ನೆಕ್ಸ್ಟು ಇವರನ್ನು ಯಾವುದೇ ಕಾರಣ ನೋವು ಮಾಡಿದಾಗೆ ಸೊ ಹೇಗೆ ಶಿಫ್ಟ್ ಮಾಡಿ ಈ ಸ್ಪೈನ್ ಬಾಡಿಗೆ ಶಿಫ್ಟ್ ಮಾಡ್ತಾರಂತ ಆಯಿತಾ
Step 1, I call.
ಇದಕ್ಕೆ ಲಾಗ್ ರೋಲ್ ಅಂತ ಹೇಳ್ತೇವೆ ಅಂತ ಒಂದು ಕಡೆಯಿಂದ ತಿರುಗಿಸಿ ಶಿಫ್ಟ್ ಮಾಡಿ ಒಬ್ಬರಿಗೆ ಅಂತ ಆಗೋದಿಲ್ಲ ಇದು ಅಟ್ಲೀಸ್ಟ್ ಮಿನಿಮಮ್ 3 or 4 ಮೆಂಬರ್ಸ್ ಬೇಕು 3 ಇಂದ 4 ಜನ ಇದ್ದರೆ ನೀವು ಇದು ಮಾಡಬೇಕು
Ready? 1, 2, 3, roll.
ನೋಡಿ ಎಂಟೈರ್ ಬಾಡಿ ಟರ್ನ್ ಆಗ್ತಾ ಉಂಟಲ್ಲ ಸೊ ಎಲ್ಲೂ ಸಹ ಇದಾಗೋದಿಲ್ಲ ಸೊ ಬೋರ್ಡನ್ನು ಪ್ಲೇಸ್ ಮಾಡಿ
Ready? 3, 2, 1, back.
ಇದು ಹೇಗೆ ಅಂದರೆ ಎಲ್ಲರೂ ನೀವು ಇವರು ಯಾರು ಮ್ಯಾನೇಜ್ ಮಾಡ್ತಾರೆ ಅವರು ಟೀಮ್ ಲೀಡರ್ ಅಂತ ಅವರು ಹೇಳ್ದಾಗೆ ನೀವು ಬಿಡಬೇಕು ಕೊನೆ ಟೈಮ್ ಏನಾಗ್ತದೆ ಯಾರ್ದೋ ಒಂದು ಫೋನ್ ಬರ್ತದೆ ಕಿಸೆಯಲ್ಲಿ ಹಲೋ ಇಲ್ಲೇ ಇದ್ದೇನೆ ಸೊ
I'm coming to you. Sir, are you okay? Not responding. Checking for pulse. I need help. Get a spine cord, collar. Pulse is there. Okay, let's get the collar up. Collar is done. The next step, let's try to get him onto the spine board. Ready? Look how they are holding their hands.
Yes.
Overlapping hands. Very good. One hand on the shoulder, one hand on the hip. The other person's hand overrides the other person, and then on the. If there is one more person, he can come here. Like this. Okay? So a log roll. The fourth person comes with the spine ball. Okay. Log roll at the counter. 1, 2, 3. Super. So I'm looking at the back for any other injuries. Okay, sir. 1, 2, 3.
Yes.
Yes. Okay. So let's strap him now.
ಇವಾಗ ಹೇಗಾದರೂ ಮೂವ್ಮೆಂಟ್ ಮಾಡ್ಬೋದು ನೀವು, ಪೇಷಂಟ್ ಅಲ್ಲ ಬೋರ್ಡನ್ನು. ಯಾಕೆಂದರೆ ಪೇಷಂಟ್ ಆನ್ ಬೋರ್ಡಲ್ಲಿ ಇರ್ತಾರೆ. ಸೊ ಯಾವುದೇ ಕಾರಣಕ್ಕೂ ಪೇಷಂಟಿಗೆ ಸ್ಪೈನ್ ಆಗಲಿ ಅಥವಾ ಕುತ್ತಿಗೆ ಆಗಲಿ ಎಲ್ಲ ಸ್ಟೆಬಿಲೈಸ್ ಆಗಿದೆ. ಯು ಕ್ಯಾನ್ ಮೂವ್ ಇಟ್. ಆಯಿತಾ? ಬೋರ್ಡನ್ನು ಆಚೆ ಈಚೆ ಮಾಡಿದರೆ ಸಹ ಏನು ತೊಂದರೆ ಆಗೋದಿಲ್ಲ. ಕೂತಿರಿ. ಟೈಟ್ ಮಾಡಿ.
Done? Now what do you do? Okay, so one person, sorry. You come here, sir. You come. You come. 3. And then I can hold this thing. Ready? At the count of 3, 1, 2, 3, lift. Okay? And then shift on to the. Now it becomes easier for transfer. Unstrap the helmet. Step 1. Okay. Any other suggestions? If the patient is conscious, oriented, pregnant, they can remove it on their own. But if he is injured, if he's got head injury, he won't be able to remove. What do you do then? Any ideas? Step 1, one person will stabilize. Excellent, everybody. So one person will come, stabilize. Aida. Step 1, at the head. Step 2, open the visor. Try talking to him again. Hello, sir, are you okay? We are trying to help you here. Okay? Next step, open the collar, open the belt. Next step, you can take over. Yeah. So he can take over. Next stabilization. He's taken over now. I'm free. Okay? My step would be, just for everybody's sake, I'll expand the helmet once, like this, and then I'll hold the back. Make sure that neck is not moving, and I'll remove the helmet over his nose. Done. Then I'll apply the collar. Clear? So before removing the helmet, always, after opening the belt, always expand the helmet once. Otherwise he get caught in the ear. He will stuck up. And then when you're coming over, make sure you roll the front part first and then the back, so that it comes over the nose. Clear? So skill number 3, helmet removal. So we learned collar application, we learned log rolling, we learned helmet removal. We learned one more important skill. Thank you, dear. Thank you. Injury with the leg like this. What will you do with this piece? Completely cut away. What will you do with the piece?
ಅಲ್ಲೇ ಬಿಡ್ತಾರೆ ಯೂಶುವಲಿ. ಅದು ತಗೊಂಡು ಬರ್ತೀವಿ.
You completely cut away. Ear can be cut. 4 days back, Trump had a gunshot injury to his ear. No? Ear can be cut off. Nose can be cut off. What would you do? How will you preserve this pocket? What will you do? Ice pack. How will you put it in ice pack? We get fish in an ice pack. Do we put it like that? Then how do you put it? Very good. You put this in a plastic cover and take that plastic cover and then put it in another cover full of ice. Clear? And bring it to the hospital. Whatever be the piece. That's one more thing that you have learned today. Okay? Some people say you put it in your mouth and bring. Don't do all that. There are people who have done that. Okay?
You take a Ziploc or something like a
Ziploc cover. Drop this piece into a Ziploc cover. Take this cover, close it, and then drop it into ice. Do not drop it directly in ice. Clear? Okay. So once you have excessive bleeding, what will you do? Pressure. But the bleeding is too much. The artery is cut. Very good. So there are different tourniquets that we can use. Now this is one which is there in the market. You can use your dupatta You can use your kerchief. You can use a towel. Okay? Where do you tie the tourniquet if you've got a wound here? One joint above. Okay? Midway between both the joints above. So midway between the joint, sir is trying to apply here. This is called a combat tourniquet. This is actually used in the field, war field, even in the road also we can use. So what we do is we apply a tourniquet. I'll tell you how to modify this now. So I'm applying the tourniquet. Did you see time is written here? Time. So time of tourniquet application. Time of tourniquet application. Once that this is applied, I lock it. I tighten it with this. This is called a windlass. Okay. Now people are older generation people used to do this. They'll do one tie with a towel, keep one stick, tie over the stick and then tighten the stick. Same principle. Why is that so? Because you will cut the pulse, cut all the bleeding below the knee. So you can use this, tie one with a dupatta, get a strong stick, not a very small stick, get a strong stick, keep it there, tie over it and then tighten it till the bleeding stops. Clear? Till bleeding stops and then bring to the hospital. But don't keep it like that for a long time. Every hour, check. Within 6 hours, operation should be done. Clear? This is more common in big RPAs, accidents where you pull the leg out, half the leg is gone. Then you need to do this. Clear? So we learned another skill set. Combat tourniquet or tourniquet application. Now, this is called a windlass, 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 where if you turn the windlass, it becomes tighter and tighter to cut the complete blood supply downwards. Here either, you can modify it by using a stem or a big branch. Yeah? That's another skill that you have learned. In addition to, other thing was pressure. Simple. The scarf is this. I have my hands over the scarf. Right? Hands over the scarf. One full rotation. One full rotation. I think it's done. This edge will go to this side, this edge will go to the other side. Both the hands, I'll make it free and make it wider, like this. Okay? And then I'll ask madam to put her hands inside. Okay? And then wait, no, relax. I think. Here. So if you have a magazine or a paper, you can actually keep it into the paper. Okay? If you have a magazine or a paper. So we'll try once. You remember? Morning was so far away. So, young male, after accident, he was not talking at the scene downstairs. You had given him a cervical collar. You had log rolled him onto a spine board. You have transferred the spine board onto the ambulance. Somebody has maybe attempted an IV access also, and they're trying to bring the patient here. So once the patient comes here, what will I look for first? Again? The recognition part is always the same, correct. The recognition part is always the same. What is the thing that I look for? First part, I check for response and ask him his name. Sir, my name is Manipal, I am here to help you. What's your name? Right? If he talks, what does it say? If he talks, airway is fine. Or he is angry with me. Right? Sometimes at home, we don't talk because of other issues, but airway is fine. After that, what do you do? Check for pulse. If he is not talking, very good, check for a pulse. Make sure he is not in cardiac arrest. Because in cardiac arrest, what do you do? Suppose I collapse here on the floor, what do you do? Check for response. You will need to start. You will have to check for response, check for pulse, scan for breathing, and do CPR. So when you go to railway station, airport, you have something called the AED also there. What is the AED? Automated external defibrillator. You go to that. You have seen, na? In the airport, in the railway station, if you go to a big concert, or if you go to a big political meeting, one big leader is coming to talk. No? Modi ji came to Udupi. or Mangalore, Amisha came down, what do they have? They should have an AED. And the people should know how to use an AED. So how do you use an AED? In India? The hospital team might know because they are used to it. How do you use an AED? You switch on and follow instructions. How do you switch on? It is like your mobile only. Same mobile switching on. In the mobile there is a operating device. No? Switch on, switch off for the mobile. It's like 0 and a 1 together, put together. So that button is a green colored button everywhere in the world. You go to China, it will be written in Chinese, but the symbol will never change. So you switch on the green button and then you attach the pads. Where do you attach the pads? Right side, because the heart is here. You attach one pad on the right infraclavicular region, everybody can see, right? And then you attach one on the left side below the armpit or below the axilla. So you have a shock which is going to come in between the heart. Clear? And after that, you plug on the device and you give a shock. If the orange button or the machine says, please deliver shock, then you give the shock. It is very easy. If you go to YouTube today and just type in using an AED, it will give you a video. Okay? It is just switching on and following instructions. It is not meant for a healthcare professional. It can be used by anyone at any point in time. Clear? If you go to a marriage, the marriage hall needs to have an AED. If you go to a movie theater, that place needs to have an AED because anybody can have a cardiac arrest at any point in time, and you may need to use it also. It happened on the day of my marriage. I was on stage, evening on the day of my marriage, and I think the same shirt, I think 11 years back. I'm using the same shirt today. I was there on stage. My uncle had collapsed on stage. I started CPR. My friends were as usual half an hour late for the wedding. And then I started CPR. My wife was holding his legs up. I was doing CPR completely drenched in sweat. By around 10 minutes, we were completely soaked in sweat. My friends came in. They got hold of the AED. We shocked him 5 times on stage. The cameraman, who was still then the boss, he was telling us, hey, chin up, shoulder down, look here, it's mine. He collapsed, seeing the resuscitation. So I don't have it in the video feed. We resuscitated him for around 13 minutes on stage. And then somebody called an ambulance. Ambulance has come down. We had one person from the ambulance bringing in an IV. So IV was given. We had given him some drugs also on stage. I was giving CPR en route to the ambulance. Inside the ambulance that's when somebody tapped me and told me, Vimal, go get married soon. Fortunately for me, unfortunately for my wife, we are married. Huh? But the good part was my uncle had a massive MI, which actually led to the cardiac arrest on stage. So it can happen anytime. More possible for all my respected colleagues in the force, because you will be the first person there. The common man might not know what to do. And they'll call you. And they'll call you with an expectation that you know. Are you getting my point? So it's a huge responsibility on your shoulders. And we are ready to help you live up to that responsibility by teaching you this. Okay? So trauma, you know certain skill sets now that you can do on the field. You won't feel restless when you see a trauma case next time. To help them without making any mistake. Clear? So I spoke about AED also. Today you will go back and use your mobile smartphones to just view one video of a automated external defibrillator. Having PP, gloves, and gown and all, we are not wearing it so that you can see what they are doing right now. So what will he do initially when the patient comes in? Talk to the patient, check response, check pulse, talk to the patient. If collar is there, collar is not there, apply the collar. Clear? Until that is clear for everyone? This is what we did downstairs. We applied the collar and we brought him here. What is the next step? We spoke about this in the morning. A. What do you do in A? You start him on? Very good. So you start him on oxygen. So somebody would have gotten a face mask. They'll start him on oxygen. Alright? We have a face mask. I saw it in the morning. Okay, so they will start on a face mask. After that, what will they do? Breathing, what do they do? They'll quickly check for whether there is any bleeding in the chest. They'll open the body. They'll check for any bleeding in the chest wall, and they will check for whether air is coming inside clearly. They'll check whether air is coming inside clearly. If there is a problem, they will try to drain the water or the air or the blood which is there in the. If the patient is not breathing, suppose somebody is from Manipal, he went to swim in the sea and got drowned. If they pull him out, using a bag mask device is indicated. You might need to give breaths. So how do you give breaths? Just I can just show them how do you give breaths.
ಸೊ ದಿ ಸ್ಪೆಷಲ್ ಟ್ರಾಮಾ ನಾವು ಜಾಸ್ತಿ ಕುತ್ತಿಗೆನೆ ಎಕ್ಸ್ಟೆಂಡ್ ಮಾಡಲಿಕ್ಕಿಲ್ಲ ಆಯಿತಾ, ಜಸ್ಟ್ ಪ್ಲೇಸ್ ನ್ಯೂಟ್ರಲ್ ಇರಲಿ. ಇವಾಗ ನಾವು BLS ನೋಡಿದ್ದೀವಿ. BLS ನೋಡುವಾಗ ಎಷ್ಟು ಪೇಷಂಟ್ ರೆಸ್ಪಾಂಡ್ ಇಲ್ಲ ಅಂತ ಹೇಳಿದರೆ, ಸೊ ನಾವು 30 ಕಂಪ್ರೆಷನ್ ಕೊಟ್ಟರು, 2 ಬ್ರೆತ್ ಕೊಟ್ಟರು, ಹೌದಲ್ವಾ? 30 ಚೆಸ್ಟ್ ಕಂಪ್ರೆಷನ್ ಮತ್ತು 2 ಬ್ರೆತ್. ಪೇಷಂಟ್ ಹಾಗೆ ರೆಸ್ಪಾಂಡ್ ಇದ್ದರೆ ನೀವೇನು ಮಾಡಿ, ಪೇಷಂಟ್ ಅವರು ಉಸಿರಾಡ್ತಿದ್ದಾರೆ ಅಂದರೆ ಜಸ್ಟ್ ಯು ಗಿವ್ ಅ ಸಪೋರ್ಟ್ ಮಾಡಿ. ಓಕೆ, ಜಸ್ಟ್ ಯು ಗಿವ್ ಸಪೋರ್ಟ್ ಎವ್ರಿ 6 ಸೆಕೆಂಡ್. ನಿಮಗೆ ಐಡಿಯಲ್ ಅಂದರೆ 10 to 12 ಬ್ರೆತ್ ಬರ್ತದೆ. ಸೊ ಒಂದು 10 ರಿಂದ 12 ಬ್ರೆತ್ ನೀವು ಕೊಡ್ಬೋದು. ಚೆಸ್ಟ್ ರೈಸ್ ಆಗ್ತದ ನೋಡಬೇಕು. ಚೆಸ್ಟ್ ರೈಸ್ ಆಗ್ತದೆ ಅಂದರೆ ಸೊ ಯು ಆರ್ ಗಿವಿಂಗ್ ಗುಡ್ ಬ್ರೆತ್. ಸೊ ಇದರಲ್ಲಿ ನೋಡಿದರೆ ಸ್ವಲ್ಪ ಚೆಸ್ಟ್ ರೈಸ್ ಉಂಟು. ಸೊ ಹಾಗಾಗಿ ಏನಾಗ್ತದೆ, ಸೊ ವಿ ಆರ್ ಗಿವಿಂಗ್.
So swimming pool drowning victim, swimming in the sea victim, ಏನಾದ್ರು called one of them. You tilt the chin and get. Don't take all the air in the world because we are not trying to inflate a balloon. We're just giving him some breath. Him or her some breath. So mouth to mouth you can give, or you can use a bag mask device, because every time you push, air will come back.
ಮೇಡಮ್, ಫಸ್ಟು ಏನಾದರೂ ರೋಡ್ ಟ್ರಾಫಿಕ್ ಆಕ್ಸಿಡೆಂಟು ಅಥವಾ ಬರ್ನ್ ಇಂಜುರೀಸ್ ಏನಾದರೂ ಆದರೆ ಫಸ್ಟು ಪೊಲೀಸಿಗೆ ಕಾಲ್ ಬರ್ತದೆ, ನಾವು ಸ್ಪಾಟಿಗೆ ಹೋಗ್ತೀವಿ. ಈಗ ಹೇಳಿರೋ ಇಷ್ಟು ಇನ್ಫಾರ್ಮೇಷನ್ನು ನಮಗೆ ತುಂಬ ಯೂಸ್ಫುಲ್ ಆಗುತ್ತೆ. ನಮ್ಮ ಮೂಲಕ ಕೆಲವರು ಪಬ್ಲಿಕ್ಸಿಗೆ ಈ ಏನು ಇನ್ಫಾರ್ಮೇಷನ್ ಕೊಟ್ಟಿದ್ದಾರೆ ಅದು ಪಬ್ಲಿಕ್ಕಿಗೆ ರೀಚ್ ಆಗ್ತದೆ ಅಂತ ನನ್ನ ಅನಿಸಿಕೆ. ಕೆಲವೊಂದು ಸ್ಪಾಟಲ್ಲಿ ಪಬ್ಲಿಕ್ಸ್ ಇರ್ತಾರೆ, ಅವರು ಕೆಲವೊಂದು ಮೆಜರ್ಸನ್ನು ರಾಂಗ್ ಆಗಿ ಇದು ಮಾಡಿರ್ತಾರೆ. ಸೊ ನಾವು ಅವರಿಗೆ ಹೇಳೋದ್ರಿಂದ ಅವರು ಒಂದಿಷ್ಟು ಜನರಿಗೆ ಹೇಳ್ತಾರೆ. ಸೊ ಇದು ತುಂಬ ಜನರಿಗೆ ನಮ್ಮ ಮೂಲಕನೂ ರೀಚ್ ಆಗ್ತದೆ ಅಂತ ನನ್ನ ಅನಿಸಿಕೆ. ಸೊ ಇದು ಇಂಥ ಒಂದು ವರ್ಕ್ಶಾಪಿಗೆ ನಮ್ಮನ್ನು ಕರೆಸಿದ್ದು ನಮ್ಮ ಇಲಾಖೆ ವತಿಯಿಂದ ತಮ್ಮ ಇನ್ಸ್ಟಿಟ್ಯೂಷನ್ಗೆ ತುಂಬ ಧನ್ಯವಾದವನ್ನು ತಿಳಿಸ್ತೀನಿ.
I think I'll give to Patrick because you are from you are an outsider against our population. So
once more, thanks for the opportunity. One statement I would really make here is I believe that knowledge is power. Once you've got knowledge, if you apply it, like I said, correctly, then the job is done. These presentations that we have gone through, to me, they've instilled so much information about you being aware of what is happening around you, triggering the instinct, what you have to do to save a life. Thank you very much.
I would like to thank all of you all for organizing this. It has given us a really good insight as to how medical and even non-medical streams, different branches, can all improve patient outcome. In the end, no matter what we do, it all depends on how good everyone puts in efforts to actually improve or increase the possibilities of a patient surviving whatever traumatic event they have gone through. So thank you.
let's give a big hand. Now I'd like to introduce one of the Manipal Center of Excellence in Interprofessional Advanced Wound Care. This is the 4-credit course which we are developing and which we will be providing the healthcare professionals. This is very unique because when we want to learn about wound, it is working together. So we have teams from the medical team like plastic surgery, orthopedics, surgery department as well as the oncology. So we have specialized area where the entire team is being specialized on various wounds, including stomach care, then innovative wounds, plastic surgery wounds, and all kinds of wounds that come into the hospital. So we are looking at how we can give the best to the patients without much of time into the hospital's stay length. So we're trying to give care in the hospital as well as on field, because people do not have time and money and also people to bring them every single day for dressing. So we are trying our best to see that in the few months to come, we'll also have wounds on field where we'll be able to cater to the needs of the public. I think this is very important and unique, and with the kind of research that we are looking ahead, I'm sure we'll be able to bring some innovative solutions for the people of this place, at least to begin with. So we hope we hope and endure and to do good work to train our graduates who are coming out. At least they have some skills in their hands to manage them efficiently. So advanced wound care is a must, because patients are going home with multiple wounds, and also the advanced wounds they are going home with. So I think it is good that we teach our graduates so that we reach to the community very safely, and efficient care can be given by building capacity to the caregivers, so that the wounds are not going back to worse. Rather, we'll be able to stay down the wound and then treat them over time. So, by now, you all would have seen few of the glimpses of my workshop. I'm sure would have given you some tickling feeling in your mind. And we have beautiful things at Manipal. You can see out here. We have beautiful weather at this point of time. Manipal has monsoon, and it's a beautiful place where almost we have students from over the globe, and we have faculty from all over. And this is a small campus where we dwell all together. There is no majority, and everyone is just one community, and it's a beautiful place. And please come explore for yourself, and welcome to Manipal. And for my contact details, it's below. You can contact me and come for the certificate courses and get your 4 credit course.